Hello, good afternoon, everyone. Welcome again to another episode of Doctors Go Live on Columbia Asia Facebook. Today, we will be talking about a very common disease in ophthalmology, which is glaucoma. Okay, did you know that untreated glaucoma can lead to blindness? So obviously, this is a very serious matter, which is why our topic is why you should take glaucoma seriously. And to discuss this with us, we have all the way from Columbia Asia Hospital Klang, Dr. Siva Kumar Sundralingam, who is the consultant ophthalmologist there. Hello, Dr. Siva, how are you?
Hello, hi, good evening. I'm okay.
It's good to know. Good, good. We're all good here, all ready to talk about this serious topic of glaucoma. Okay, first of all, okay, we can just start right away. Let's take a look at a cross-section of a healthy eye. Okay, I'll leave it to you, doctor, and the slides.
Okay, all right. So before I can explain glaucoma, let me explain the eye, okay, how it functions. So you
Okay.
can see in the front, the light, as the light enters, it actually strikes the cornea first. The cornea
Yeah.
has the highest power where it actually focuses the light to the back of the eye, and then it passes through the next level until the lens, the crystalline lens, and finally to the
Okay. Okay.
retina. Okay, so whenever there is a problem in this what you call focusing system, and where the
Yeah.
eye cannot detect the light properly, there will be a disturbance in the image. It can be in the front and can be the back. So now we're going to talk about the optic nerve, okay, and the retina, which is the cause of the glaucoma to arise and causing blindness for them. Okay, so the next slide and go. Right. So what we see normally in normal human being is this is the fundus. This is the retina. This is the screen. So as
Okay.
I said earlier, there is a focusing system in the eye, the lens, and where as well as the screen. The screen is just like our Fuji and Kodak film last time when we used to have a camera. So if the retina has a problem where the nerves are dying, you cannot perceive the image and you actually can lead to blindness. So this is what we see usually when we check our fundus. And you can see right at the right hand corner there is a yellowish disc. Okay, that's called an optic disc. So whatever image we see is actually posted into the retina, and then it will be taken to the optic disc, the yellow area where it takes to the brain to be processed. If there is a problem in this pathway where the nerves are compromised, then they will go blind. So next slide. So what is glaucoma? Actually, glaucoma refers to a group of disease which has optic neuropathy, which is what you've seen earlier, where the nerves are damaged, so they cannot see properly. Then they also have a specific pattern of visual field loss, which I will show you later, and
Okay.
raised intraocular pressure. Raised intraocular pressure can be or cannot, it doesn't mean that a patient has a normal pressure would not have glaucoma. They can have glaucoma because there are more younger people having glaucoma with just normal pressure. So whenever there is a damage to the optic nerve, which this actually irreversible damage because the nerves are already dead. There is no more flow of blood. There's no more oxygenation for the nerves, and they die. You cannot regenerate. Once you have glaucoma, once you have nerve damage, it cannot be reversed. So the normal pressure usually is within 10 to 21. So anything above
Right.
the patients are prone to glaucoma. But that's what I'm just telling. That is just the normal glaucoma. Now we have another group of glaucoma for younger people where they have this normotensive glaucoma where the pressure is normal, but they still have nerve damage. Okay, so we go to the next slide. So glaucoma, this is just a brief one. We don't need to go into so detail. Glaucoma can present even as a baby. When the child is born, they can also have glaucoma. So that's congenital and developmental glaucoma. So and that's more of associated with many syndromes. All right. So babies born do have glaucoma, and they present with specific pattern in the eye. The way the eye is presented, we know that something is wrong. Okay, but mostly the other individuals, the adults, they usually have primary glaucoma, which is either primary open angle glaucoma or primary angle closure glaucoma. So for primary open angle, it's more common. That's when you can have a raised intraocular pressure or can be normal eye pressure also. All right, primary angle closure glaucoma, usually the pressure is very high. Okay, go to the next slide then. So what do actually people perceive when they have this glaucoma? If you can see the top left-hand corner, the patient has normal vision. This is what we all see.
Yes.
But glaucoma is what they call stealer of blindness. You don't know you have it until it's too late. So as you can see, do you know why? Because you can see from the side, actually the blindness starts from the side, all the way from the side until you get a tunnel vision, which is from the extreme glaucoma there. So what happens is the people actually, when they're driving the car and suddenly they notice a motorbike just came into their field and they don't realize why it suddenly came. And then when they come for check, then only they realize that actually they have quite a lot of glaucoma damage. Because this is how
Doctor,
the
sorry.
glaucoma presents. Yeah?
No, carry on, carry on.
Yeah. So that's how a glaucoma presents. And so we want to pick up early before it gets into this level.
Okay. Doctor, before we go into the symptoms area, maybe symptoms. I would like to backtrack a little bit and just ask about the profile of the patient who usually gets glaucoma, because I think all the while we are thinking glaucoma is mostly, it happens among the elderly. Is that the
Right.
developmental glaucoma that you were talking about, that it
No,
develops from year to year?
developmental is more of when they were born and they already have a specific disorder of the eye. So that's when they develop. Okay, but the primary glaucoma is when the one which occurs spontaneously, just like when we have hypertension and diabetic and all that later on in life. Okay, developmental is already they have a specific problem in the eye when you were born.
Okay, all right. And then because glaucoma, apparently the symptoms are hard to detect, which we will go into later. But you mentioned the nickname that is given to glaucoma, schema of blindness. Was that it?
Stealer of blindness.
Stealer or
Stealer of sight.
okay.
Stealer of sight. Sorry.
Yeah,
Stealer
yeah,
of
yeah.
sight.
So,
Yeah.
right. So is there any way for a person who feels like they are going through a tunnel vision like this slide, because perhaps they can see it, their angles, all four angles are getting darker and darker. So if they suspect this at all, would they get a symptom before it gets to this stage?
Not at all. Actually, the symptoms only in primary angle closure glaucoma or secondary glaucoma, where secondary glaucoma is something has occurred, where trauma or sometimes a cataract which has become so dense and very thick, then they can have pressure to be raised and they'll have very bad pain in the eye at time.
I
So
see. So
primary
it's
open angle glaucoma usually they don't have anything.
no, so it's not straightforward lah, because I think all this while the perception is glaucoma happens because you're old, or because of something that affects the retina. But it seems that there are a lot of factors that contribute to someone getting glaucoma.
Yes, there is a lot more factors. Yeah, there is a lot of factors which I will explain in the next slide, some of
Okay,
the common
right.
slides here. Yeah.
Okay, let's take a look at that. The next slide.
Okay, so we can, as you can see, primary glaucoma, usually they don't present with any symptoms, all right? The one primary open angle glaucoma, to be specific. Only the secondary glaucoma, they may have symptoms. That's what, as I told, secondary glaucoma is like whenever they have a trauma to the eye, or when they have a cataract and the cataract was not removed and the cataract gets bigger and bigger and causes a blockage, and that's why the pressure goes up. So primary glaucoma is where majority of the people are suffering from, and they don't know they have it because they do not have any symptoms. Okay, the next slide, Leo.
Okay, Doctor, sorry to interrupt you again. There was a figure just now that you showed in the earlier slides. I think 10 to 21 you were mentioning, and if it's higher than that, then the chances of that person getting glaucoma is very high.
The pressure can be high, but if it doesn't cause any nerve damage, we do not call it as glaucoma. We call it an ocular hypertension. But if there is a nerve damage associated with the pressure high, then we can call it as glaucoma.
I see. Yeah, because where I was going to get at is because let's say if you go for health screenings, eye health screening, because you do get sometimes at a package
Hmm.
together with eye test. So is an eye test enough to to detect glaucoma?
No, no, no. That's not enough. We have to do a proper screening where we have to take a. The most common screening we do is taking a fundus photography, and based on the fundus photography, we see the optic disc, which I showed you, that yellowish disc. So if that disc has signs showing that it has glaucoma features, then we have to investigate further. So usually, normal screening is taking a fundus photo and we do check the pressure. Uh, Commonly used is the air path or some of the more general screening machines we have for the glaucoma. So those two things usually people do for screening.
Okay, okay, all right. Come, let's continue with the symptoms.
Yeah. So the
Sorry,
symptoms.
doctor, keep
No, no problem.
interrupting.
No problem. So as I said, commonly are asymptomatic people, all right, and they are usually detected incidentally. Okay, so usually these people present with other complaints, and when we check the eye, and then we notice they have it, all right. So as what some of them can have mild headache or ocular pain if the pressure is really high, and they'll have some minimal blurring of vision. As I told you, it's so silent, it steals the sight that you don't know you have it. Then the patients also complain of frequent changes of glasses because they think that it's just a common refractive error, but actually glaucoma is setting in more and more. So their vision is getting worse and worse, but they don't realize it and they keep changing like glasses, right? And then subjective visual field defect occasionally. So sometimes, as what I said, that sometimes they will feel certain part of their views, their visual field, well, whatever they're seeing, something is missing. Like one area of the field is vision missing. So as I told you, suddenly they notice a motorbike coming and they don't realize it was there. So that part of the vision is already compromised. So those are the some of the signs patients can have in glaucoma.
You see. The one that says ocular pain, how can you describe the pain? What
Okay.
is ocular pain?
So ocular pain is an eye pain, right? So mostly happens in secondary glaucoma. Okay, the primary glaucoma, as I told you, is usually very asymptomatic. Now,
Okay.
glaucoma, as I can tell you, right, the primary glaucoma, they do not have any eye pain, but there are a lot of risk factors involved, which actually causes the changes of glaucoma changes. Example, migraine. Patients actually have the migraine and the blood. There's compromise of the blood vasculature. So when that happens, there's not enough blood supply to the nerves, and the nerves start to die. So even migraine causes glaucoma. That can present as a headache. Okay, and eye pain usually occurs in secondary glaucoma, where these patients sometimes they have very intense pain out of a sudden. They feel like there's somebody sticking a hammer and hitting their head, and it's so painful that they will come in the middle of the night, and then when we check, the pressure is very high. Okay, so those are usually happen in secondary glaucoma, but primary glaucoma usually very mild pain unless the pressure is just moderately high.
So you mean the pain is not in the eye itself, like it's actually the
Around the
headache, the
can,
migraine.
yeah, can be in the eye and around the eye, the head, the temporal
Oh, I see.
region. Yeah. So
Okay.
it can present like even like a very bad migraine.
I see. All right.
Okay.
Okay,
So
let's take the next slide.
so this is how we're going to go and diagnose glaucoma, right? As I showed you earlier in the fundus photography earlier, the retina,
Yeah.
and I showed you the optic disc, how the optic disc actually changes, which occurs, right? And then this is what occurs for the nerve damage. And we can see the optic disc, the first picture there. You see a disc, and the center of it, there's a white color small disc area. So that white color area, actually, there's no nerves inside there. The nerves are in the pinkish area, which is surrounding the white area. So this is the normal picture. So when you see the subsequent photos, the whitish area in the center starts to increase in size. It means
Yeah.
that that area actually has no nerves already. The nerves are dying. It's only left with a slight pinkish rim. That is the remaining nerves which are still healthy. So that's why when we do a fundus photography uh, for screening, and we note that if there is changes like this, we will already start to treat as a glaucoma suspect, and then we'll try to do all the investigations to make sure whether he's really having glaucoma or not. So this is the fundus finding. Okay, the next one is, okay, then once we already diagnose patient as having a glaucoma, we will do the next one is optical coherent tomography to see the disc, whether there is really a nerve dying or maybe he is born with a disc looking like that. So when we do a scan like this, we can see, if you can see right in the center of the picture, there is some graphs. So that graphs will correspond to whether the graphs are in the normal or abnormal range. So if it's in the abnormal range, then we know that the nerves are already dying. We know that this is already an indication that the patient probably has glaucoma already. And then this is going to be our monitoring for glaucoma status. So the next thing, so this is what we'll do. Once we do a fundus photography, then we'll check the pressure, and then we examine the eye in whole, and then we do this OCT to see whether there's really a nerve damage or not. Okay, the next slide will tell you, this is what we do a Humphrey visual field. As I told you, the visual loss is from the side, from the periphery. It starts to eat from the side towards the center. So patient will do this Humphrey visual field, and then it takes about 5 minutes to do a proper test per eye, and this will detect whether there is really a nerve, damage and there is a loss of vision or not. So with the next slide, you can see that. All right, so now you can see when we ask the patient to click the button and see whether they are seeing the light or not. So these are random lights which they will see when they put their face into the tunnel. So you can see for this patient, right? You can see on the left eye, on the right eye, you can see the blackish area. So that is already the nerve getting damaged. And the left eye, the nerves are already starting to get damaged, the blackish area already. So these are our indicators that patient already has confirmed glaucoma, and we need to start treating it. And subsequently, on the months to come, we will always make sure patient does that OCT and as well as disc visual field to see that, to monitor so that the damage doesn't get further. So we can prevent it from getting further, but whatever damage has occurred, it's already going to be there. Whatever visual field loss, whatever the black spot, it is not going to go away. It is already considered that area is blind. You cannot see. So that's why it's so dangerous if you don't detect it early. Okay.
So far, there's no technology to actually give you your eyesight back once you are at this stage.
No, once it's dead, the nerves are dead. There is no oxygen supplying the nerve. The nerves are already dead.
I see. I see. And then, doctor, what is looking at? Sorry, can we go back to that slide just now?
Yeah.
Because these two visuals actually show those who are already they have glaucoma already. But
Yes.
for a normal eye, what would it look like if there is nothing wrong? A healthy eye, would it be
Okay.
all white?
Yeah, if you see the bottom one, the the top one is
Yes.
black, and the bottom is just grayish.
Yeah.
Okay, it will be just plain single dots will be around there, not like these two gray. It's a very faint gray like that. So those are normal field.
Okay.
Right?
All right.
So
Yeah.
this is how we going to diagnose glaucoma now, and then there will be the treatment aspect. Okay, so the treatment will be divided into two, usually the medication and surgical. Based on the type of glaucoma, like primary open angle glaucoma, which usually everybody has, it can be treated medically first, all right? And medically, what I mean is by eye drops, okay? Can you go to the next slide? So these are the normal common eye drops which we have. So the eye drops primary function is either one of two mechanisms. One is actually to decrease the production of the water which is forming the eyeball, okay, which is the aqueous, and as well as the increasing the flow outwards of the eyeball, which is the outflow of the aqueous. So there's two mechanisms where we can actually control the pressure of the eye. Either we stop production or increase the outlet. So that when the pressure comes down, there will be less pressure pressing on the nerves, and the nerves can actually survive better. Okay, so the blood circulation also can be more, because we are stopping pressure exerting on to compress on the nerves, right? So that's how the medication works.
Are there any side effects to this medication?
There are side
apart from
effects,
making things
but
better with the eye.
very minimal. Okay, because when we give the medication, it's basically affects only the eye. It only has the treatment towards the eye. We will know how to teach them to do punctum occlusion and all that, so that we retain the medication in the eye, so that it doesn't flow off and get wasted. So there are ways to tell them how to put the drops, and even some of the drops are already made in a way that you don't waste the drops, because the drops can be expensive. Even one drop is really expensive. But these are all essential to preserve the eyes.
Yeah. That's why maybe the ointment works better.
Not
The
there is
ointment
no
type.
ointment for eyes. For the glaucoma drops, they are all basically just water droplets like that.
Oh, I see. Okay.
Yeah. Okay, so that's the medication what we have, and finally then surgically. Okay, there's two types of surgery which is done. If you see on the left, the surgical method is actually to have an alternate exit for the aqueous, which is actually forming the eyeball to leave the eye. So if the aqueous leaves the eye, the pressure can fall down. So if you see on the left, that's called a trabeculectomy. So trabeculectomy is when you create like a trap door near the cornea and the sclera there, the limbal area. And whenever the pressure of the eye goes up, the water can flow out and into a collection sac at the back of the eye. Okay, so it's like a trap door where the pressure water can flow out, right? And the second one is called glaucoma drainage device. Okay, there are few devices available. So these devices, some have valves, some have no valve. So whenever if you can see there, like when the pressure inside the eye goes high, or when the aqueous is a lot being produced, it actually flows through the tubes into the outside of the eye and into a collection bag at the back of the eye there. So these are the two methods surgically where we can control the eye, the pressure of the eye.
So these surgeries are available at Columbia Asia Hospital, Klang?
I don't do these surgeries because it's a bit complicated and time consuming. I treat it medically first, though we know how to do it, but this is a bit time consuming. We don't really do it here. So usually I will refer to a glaucoma surgeon to do it.
Oh, I see. So this is a what do you call it? Worst case scenario, but before it gets to this stage, okay.
Yes, usually in this stage, patient is on full eye drops and they cannot be maintained with eye drops, and the vision is already quite bad. So it's a very risky operation also. Number one, okay. So we have to make sure that it's done correctly and the pressure can be controlled correctly. Yeah.
So the lesson here is that as soon as you feel that there is something wrong with your eyesight, just go and check.
Yes,
it might be something as serious as this.
Correct, because you don't know. As I told you, right now, the majority of the people have this thing called normotensive glaucoma, where they have no symptoms, the pressure is not high, but the nerves are getting damaged. People with migraines are very prone to get this, and I've diagnosed a lot of people with this now.
Right. Majority of your patients who come and complain of who are diagnosed with glaucoma, how old are they? The age range?
Okay, okay. One of the risk factors for glaucoma is family history. So if a sibling has glaucoma, the other sibling has very high chance of getting glaucoma too, or even from parents to the children. So a lot of them, once the parents are diagnosed glaucoma, even the children are advised to diagnose glaucoma. So even as early as 40s, 50s, and all that, they do have some glaucoma changes.
And is there any other like behavioral factors that
Uh,
increases the chances, yeah, of a person getting glaucoma? For example, the work that they do, looking at computer often, or it
Not,
doesn't have
not
anything to do with
not really
students.
work related, but more to lifestyle. Smoking, very high chance getting because you're decreasing the blood oxygenation. And then, even they postulate drinking coffee actually can predispose to glaucoma. Although they don't know really the mechanism or how it works, but it does has a cause of it also. So this is more
This
of
is
like,
someone who takes coffee like extensively lah.
yeah, correct.
Wow, well, that's new. That's very new information. Coffee can cause glaucoma. Okay.
Yeah, they postulate that one of the risk factors only.
Yeah. What are the risk factors are there? The common ones so that we can have.
Okay,
So
mostly is
yeah.
very important is family history. Number
Okay.
two is lifestyle. Okay, what lifestyle is it? Number three is the cornea thickness. The cornea thickness, it plays a significant role in patients who are getting glaucoma. And number four, when patients are myope, high myope people are more chances of getting open angle glaucoma like that. Shorter eyeball people more chances of getting angle closure glaucoma. So a lot of factors are involved, but these are more the common ones.
All right. Can we see what's next with the slides? Oh,
Yeah,
you're welcome.
yeah.
Okay, doctor. Now let's take a look at some of the questions that we already have. Okay, they're waiting first. One is from Miss Lauren Yate. Lauren Yate. Her question is glaucoma genetic? And from family history, which you've already explained earlier. Is there anything you'd like to add to this?
Yeah, glaucoma this has a genetic
Yeah.
predisposition, and all family. If one person in the family has diagnosed to be have glaucoma, you have to actually get everybody to screen for it because there is chance of others getting it. So it's quite important for everybody to just have a screening. Not necessarily you have to come very regularly, at least once a year, and that's it, just to have a look.
Okay. So, at what age would you recommend for people with a family history of glaucoma to go for health screening?
Oh, it's very subjective. It depends on it doesn't have, they don't really have a specific age, but anyone with above 20s, 30s already you can start coming for your regular checks.
Okay. All right. Here's another question. This is by Ms. Siti Akila Syed. Is it true that diabetic patients are more likely to develop glaucoma?
Yes, it's true. Diabetes have predisposition for developing glaucoma. Mostly
Yeah.
it's because diabetic actually plays a role in the blood flow. So the blood becomes more sticky, more thicker, and so when the blood doesn't flow properly into the vasculature, the nerves don't get enough supply and it starts to die, and that's how you can also get glaucoma.
Okay. Mrs. Celia Chong is asking, does wearing contact lenses cause glaucoma?
Not really. It's not really a related issue. It doesn't cause at all. It's more contact lens is more of surface related problems you have. Nothing to do with glaucoma.
Okay. There is a question here from Miss Felicia Sitan. How do you prevent getting glaucoma?
Okay.
Is there any way, yeah, to prevent?
We cannot prevent from getting glaucoma because something like hypertension and diabetic where you need to control your lifestyle. You need to try to minimize the risk of you getting it. So you have to watch your diet. Make sure you come for regular exercise, do a regular exercise because actually exercises open up your blood vessels, so you have better flow of the blood, and actually the nerves are better oxygenated. So that prevents. And also you do your regular examination. You have to do your regular blood examination to make sure you don't have any comorbids. And then if you can just come for an eye checkup. Sometimes you don't really need to come to the eye clinic itself. You can even go to the optometrist, and a good optometrist will know how to diagnose whether there is something wrong or whether they suspect or not. So a good optical shop will know what to do, and they will refer. So you don't really need to a doctor also, but you at least you know where to go.
Okay. You mentioned just now some lifestyle modifications that you can take in order to avoid getting glaucoma. Would this be food related in any way?
Yeah, they postulate that actually antioxidants, food with high antioxidants actually helps with the nerves preservation of the nerve and all that. So that one is important. So take food with a lot of high antioxidants.
Okay, so antioxidant food.
Mm.
Okay, that's good. What about the kind of exercises that you do? Because sometimes there are exercises that tend to give more pressure to the head, or what feels like more pressure. For example, if you do inversions during yoga, handstands and all that, then it feels like there's a slight pressure. What do you think of that? Is
Oh,
that
no,
a
no.
myth?
Actually, that doesn't cause any related issue to the body at all. Actually, you're just training your body to be more well equipped and more versatile, to handle stress and the daily things which you can do. So actually, it's okay, perfectly fine. It's just you're training your body to do it. So whatever you feel in that sense, actually, it's not really harming you, but actually, it's just getting your body adapted to it.
What kind of movements will actually create pressure in the eye area? Are there any specific movements, or if you are traveling and if you are up there high in the sky, or if you
Yeah,
are
actually,
diving, perhaps would that be
right.
contributing
Actually,
to
it's not more
glaucoma?
for diving more. Usually, when they do retina surgery and all that, right, they usually put gas in the eye. So they usually will tell, don't go, take the plane, don't go into high altitudes because the gas can expand and cause glaucoma. So these are secondary glaucomas. Okay, so what I was telling. So these kind of things can cause problem and damage the nerves.
Likewise, if you are like under the sea, that kind of altitude, very low,
So far,
pressure
no, not
usually
really, but not really the sea. Sea is okay.
high altitudes lah. So
Yeah,
don't
the
go
high altitude.
climbing mountains and whatnot lah.
Yeah, correct.
Okay, all right. There's a question here from Ms. Hidayah Salma. Is there any special glasses for glaucoma?
No, because glaucoma is a nerve-related problem. It has nothing to do in the front part of the eye. It's the back part of the eye. So nerves are the one which is getting damaged. So glasses really wouldn't help.
Okay, okay. I think that would be all the questions there is. So before we wrap up, are there any tips or advice that you can give us other than
Okay.
what we discussed earlier regarding
All
glaucoma?
right, sure. So please, everyone, you have a family member who is glaucoma, please go and have an eye check. Those who have strong family history, go and straight see an ophthalmologist will be better. And whatever you feel, whatever you suspect something is wrong with the eye, immediately you just go and have, because once the damage occurs, there is no reversing in a thing like glaucoma. Okay, so that's my take-home message.
Okay. Thank you so much, Doctor.
All right.
So there you go, ladies and gentlemen. You have to take this very seriously because glaucoma, there's no going back. It's going to cause blindness. So you can always go and see Dr. Siva if you would like to have your eyes checked. He is at Columbia Asia Hospital, Klang. And with that, we can see each other again soon with another topic. Okay, thank you again, Dr. Siva, and thank you
Thank
everyone
you
for
very
watching.
much, Fatina. Thank you
Bye.
very much.
Thank
Bye.
you. Bye.